Hello, my name is Osama Alui, data science student, and I'm here to present my dissertation poster, which on the topic dementia learning based machine learning based dementia prediction. I'll go start by what is dementia. Dementia is a neurodegenerative brain illness that causes nerve cells to die over time. Laura et al. 2017 states dementia to be a complex disorder associated with the brain, which affects the proper functionality of the brain. It is mostly common with the older age population, responsible for a steady cognitive deterioration, critically sufficient to disrupt the daily routine of their life, the independence, and the um, a functional lifestyle of a patient. It is stated by So et al. That the global population living with dementia is indicated to be estimated around 47.5 million. Um, early identification of dementia as well is important to ensure appropriate provision of care and services for patients, as well as ensure decisions made by the patient fit their routine in the future. So going further, using machine learning to predict dementia, the adoption of machine learning in the healthcare sector can efficiently aid the process of disseminating complex information on dementia diagnosis in an easy to understand format. The aim of my dissertation is aimed at investigating machine learning optimization performance between the conventional method and application of materialistic optimization techniques. Um, these techniques are the Bayesian and the genetic algorithm techniques on dementia prediction. So it's basically comparing the basic conventional method of machine learning with a materialistic technique, which is to help optimize results, give accurate results, better results. The objectives are to conduct an extensive literature review on existing procedures and techniques applied to determining maximum model optimization, to evaluate the variable of the data sets, to conduct data preprocessing and transformation, to conduct an exploratory data analysis, to determine the relationship between variables in a visualized manner, to apply machine learning models and materialistic techniques to determine the target variable, to evaluate the model performance and identify an appropriate machine learning model between the conventional method and the materialistic technique suitable for dementia prediction, to propose and to evaluate this model performance and identify appropriate machine learning model between the conventional and materialistic um, technique. And lastly, to propose a model which can be adopted for the prediction of dementia and also predict the possibility of dementia development in the future. So furthermore, my rationale for carrying out this study, the issue of result accuracy for futuristic decisions has been a major concern which has affected clinical analysis, decision making, and overall patient welfare as regards dementia. The performance of machine learning model is paramount, which has seen investigation and evaluation on how to improve and propose better techniques to ensure better model performance to support decision making and futuristic plan has been a subject of discussion. Therefore, the optimization of model performance for dementia prediction techniques can be achieved through model parameter optimization. Hence, this research will utilize materialistic techniques for optimizing parameters of machine learning to determine the model performance compared to the conventional employed for dementia analysis. Going further is the methodology. The methodology used for this is I employ the CRISP DM, and basically is a common methodology used for machine learning problems. And the process it involves about six process, which is business understanding, data understanding, data preparation, modeling, evaluation, and deployment. So basically, the business understanding is what do I actually want to achieve with this dissertation, which is prediction of dementia with machine learning models. The data understanding is how better do I understand the data, what am I going to use the data for, and which to determine what I'm looking for within the data. The data preparation is okay. The data has some noises. I have to clean the data up and bring the data to a good level where I can use it to develop my model. So the modeling decreased. I employed five five models: decision tree, support vector machine, XGBoost, um, um, XGBoost, K nearest neighbor, and for the metaheuristic, I employed genetic algorithm optimization and Bayesian optimization. So when employed these models, from my findings and discussions, for my findings, yeah, what I determined was from the dementia prediction, the random forest model and the XGBoost were the best performing models with an accuracy score of 83.9% and 91.8% respectively. While KNN was the worst performed model with an accuracy score of 75% for the conventional method of model application. Going further, these three models were further selected to perform the Bayesian and genetic algorithm, which now we want to compare how the accuracy of the to determine the accuracy of the if to determine how good the results will come out, the accuracy if there's an improvement in the results. So for the Bayesian optimization in comparison with the conventional method, accuracy score of random forest and XGBoost model dropped to 82 and 80% respectively, while the accuracy score for KNN increased to 77.6. That's comparing to the conventional. Going further, for the genetic algorithm optimization, the accuracy score for random forest, XGBoost, and KNN model increased to 87.5%, 91.8%, and 86% respectively. Evaluating the performance of these three models, it indicates that XGBoost in combination with genetic algorithm with a percentage of 91.8 is the best technique. So from my findings, concluding is after performing the exploratory analysis, the data indicates that the age distribution of subjects within the age range of 65 to 85 were the most predominant susceptible to develop dementia, while the ages of 73 and 75 were the most predominant within the age distribution likely to be diagnosed with dementia. Based on gender, going further, based on gender, the data indicates male were predominantly diagnosed with dementia. This is further corroborated by the clinical dementia rating scale on gender, which suggests that male were predominantly diagnosed with dementia after the scaling test was conducted. After conducting the different approaches, techniques, and evaluation, it's the results derived from the various models applied indicate the genetic algorithm in combination with XGBoost to appears to be the best technique to employ for prediction of dementia. So proposing the best model with the best accuracy score for prediction is the XGBoost, which had the highest performance. This is as a result of the dynamic nature pertaining to the dementia analysis. Below is the table showing the accuracy of each model. So genetic algorithm XGBoost indicates 91.8%. The conventional model for random forest indicates 86.9%. Conventional model XGBoost shows 84.9%. So this was carried out. So it shows that genetic algorithm has a better optimization process, better than the conventional um, method. But in comparison as well, the Bayesian optimization performed the least because it had the lowest accuracy score, um, which was 82 and 80 for XGBoost and Random Forest. Ethical considerations as well for this project carried out was the data used for this research, dementia prediction, was sourced from Kaggle. And the name of the data set is an Oasis Longitudinal Data Set after ethical clearance from Beckett University. Upon completion of this ethics form, the acquired data for research purpose will be used for the research question stated, and all subjects will be kept anonymous. anonymous. The data and information gathered over the course of this research will not be reutilized for any other purpose and will be managed or destroyed in accordance with the university guidelines and instructions. Thank you. And this is the end of